Everybody. Here we are in our last conversations on brain health for 2024. And we hope to take this opportunity to introduce a new team member to the MS Center there at Rush, Dr. Allison Osen, but as well discuss some of the updates that we have on board for 2025 and some of the exciting research projects that are going to be starting off this next year. So I'm pleased to have Adrian Castillo, Jules. We're hoping to also have Dr. Kaplan join us. Unfortunately, Dr. Shoemaker is unavailable for this evening. He is also part of this team. And Dr. Miravalle, obviously, who is the division chief of multiple sclerosis there at Rush. He is going to be kind of running the show for us this evening. So Dr. Miravalle, I'm going to turn it over to you to kind of kick us off.
Thank you, Kathy. And, I understand that this audience keeps growing. So I assume most of you know who we are, but in case you don't, we are the MS team at Rush University Medical Center. As Kathy mentioned, my name is Augusto Miravalle. I am a neurologist, and I joined this wonderful team now 18 months ago. Geez, time flies. It seems like it was yesterday, but I guess that happens when you're having fun, right? So it's been a pleasure and an honor to be part of this wonderful team. And as Kathy mentioned, we thought to use this last session of the year to introduce new members of the team, but also to have most of us an opportunity to share with you what are we doing, what is a part of our research interest, what are the projects that we are working for 2025, and perhaps some of the excitements that we have some passion in the field of multiple sclerosis and brain health. So this is our monthly webinar, the Conversations on Brain Health. We try to make it as practical as possible with topics that we hope will inspire you to make meaningful changes in your life, anywhere from nutrition to exercise to research updates. And so we are now working on 2025 on the calendar for the sessions. So we welcome your feedback. We welcome your ideas. If there are topics that you would like us to consider including, please share those topics with us. You can do so today by writing in the chat box. You can also send an email to Kathy with ideas and topics for 2025. And without further ado, I see that Dr. Kaplan is in the audience, Kathy, so maybe I can pass it back to you and you can open the mic and start the session with Dr. Kaplan.
I would love to do that. I need to find him. If you see him directly, Dr. Miravalle, if you can allow him to undo his mic, I would appreciate that because I have a slew of people on my screen. So I'm having a little bit of a hard time finding him at the moment.
You just did.
Okay, fantastic.
So Tyler, you should be able to unmute yourself.
Yes, yeah. Can you hear me okay?
Yeah, absolutely,
okay.
Dr. Kaplan. Well, thanks for joining us this evening. And Dr. Kaplan, to start us out, just because we have a very large audience and not all of the attendees are Rush MS patients. We also have other participants that take part on our conversations on brain health that are from outside the Rush system. So if you could just take a quick moment before you jump in and talk about kind of the research work that you're doing, if you could maybe just share a little bit about your training, your research interests, and any other areas of focus so our audience can get to know you a little bit better.
Yeah, certainly. Thank you, Kathy. Yes, so for those of you who may not have met me before, my name is Dr. Tyler Kaplan. I am an assistant professor here at Rush. I originally came to Rush back in 2019 when I started my fellowship here in neuroimmunology and multiple sclerosis. I came from University of Utah in Salt Lake City, where I was completing my residency. And so I came to Rush in 2019 and had the great privilege of doing a 2-year fellowship here at Rush under the tutelage of Dr. Stefosky, who we're all very familiar with. And thankfully, after I finished my fellowship, I was ultimately invited to eventually join the faculty here at Rush, and have been here in a faculty role now in my 3rd year as an attending level physician. And yeah, my primary focus is really on clinical research. So I am involved in quite a few different both clinical trials and cohort studies that have been published recently. With some long-term research regarding NMO patients on a medication called inebilizumab. And then and then lately what we're going to transition to is as part of kind of the brain health program, I've been getting involved from the clinical research perspective. So that's really kind of my background, if you will, but then transitioning as far as my main update, as far as kind of my main thing I want to talk about today is I'm very excited to announce that we were recently awarded a very generous grant from the Margaret and Charles Roberts Foundation, which is a organization that is primarily focused on supporting integrative and clinical health programs and incorporating a lot of the different aspects of the brain health program. We're kind of synthesizing it into kind of a more standard protocol, and we've been approved to do a 1-year pilot project where patients will be, and actually the name of the study, we're calling it the CLIP MS study, so Comprehensive Lifestyle Intervention Program in Multiple Sclerosis. So this is going to be a 1-year pilot project where we are going to enroll patients in the brain health course, the 2-week course that I'm sure you'll hear more about. And then following that, they will have 5 one-on-one sessions with Adrian Castillo, who runs our brain health clinic. And over the course of that study, we will be monitoring patients' overall quality of life and doing lifestyle assessments as kind of what we hope to show ultimately is that this is a feasible type of program that could be then scaled upwards into a much larger program. So we did just secure the funding from that just about a week ago. And so we're hoping to get things up and running early in 2025. And so there should be information about that as far as kind of the enrollment and kind of what we're looking for. Ultimately, as of right now, it's going to be a small study, about 20 patients. And we're specifically looking at patients who are currently Rush patients and who have not yet either been seen in the brain health clinic or gone through the brain health educational program. So for those of you that may have already done that, hopefully as we continue with this pilot project, and that this could lead to more long-term funding and being able to further scale this out for even more patients. But Jules Skoda, who's also on the calls here, she's playing a very important role for screening and enrolling patients. And so she'll kind of be the point of contact for kind of getting people initially enrolled in the program.
Excellent, Dr. Kaplan. I appreciate you explaining that to the audience. And we will be enrolling patients to the educational program. Probably the first program will be starting towards the end of January, early February timeframe. So anybody who is interested in participating, that will be an opportunity to participate in this study as well. And I think if Jules could maybe chime in as well and speak a little bit as to your involvement on this research study, that would be wonderful. Jules Skoda.
Yeah, absolutely. So again, my name is Jules, and I'm the clinical research coordinator, or one of them in the MS Center. And so I will be kind of coordinating those moving parts as we recruit patients and as we collect the patient-reported outcomes as a part of the study. And so I'll be, again, the point of contact for all of you. If you have any questions, feel free to give me a call or shoot me an email. I'm happy to kind of go through the process with you. And if for whatever reason you find that you're not eligible for this particular study. We do have other projects that are either upcoming or ongoing. One of those is that we offer to all of our patients now the use of patient-reported outcomes as a part of routine or standard of care. So what that means is that we collect baseline outcomes for you, which is a series of questionnaires and some testing. So get that initial baseline. We retest you if you've had any changes of symptoms, or if not, at regular intervals, to kind of gauge how treatment changes are doing, or how you're doing based on those treatment changes. So, and again, if you have any questions about any of that, feel free to give me a shout, and I'm happy to help you through the process.
I just want to expand on what Tyler and Jules just presented. The use of patient-reported outcomes, also known as PROs, is something that the actual NIH start pushing for researchers to include in clinical trials. I will say a decade ago, understanding that when we conduct research, traditional research will include things like MRIs, include blood work, and perhaps a clinical assessment. But a big gap in our research was, how about patients' day-to-day feelings? How about asking patients, how are you doing? And measuring the symptoms that are occurring on a day-to-day basis that perhaps are missed when the only thing you do is look at an MRI. So collectively, that part of research is known as patient-reported outcomes, which is a very important part of research these days, to the point that most clinical trials, most evidence-based clinical research includes some degree of PROs into their design. What we are doing at Rush is going a step forward from that, not only including PROs in what Dr. Kaplan is doing, which is traditional research, but now we are including PROs in the clinic. So it's that blend between research and patient care that we are passionate at Rush. One of our mission statement is, every patient is a research patient. And the reason for that is we want to collect as much information from you, not only to help us understand MS better, but also to help you today with your problems, with your symptoms, with your issues. So the more data we collect, the more we can serve you, the better we can serve you, and the more we can push this understanding of MS forward. So this blend between research and clinical is what Jules is explaining now, which is you don't have to be enrolled in a clinical trial every time you come to the visit, or even in between visits. We have the option to continue to collect that information. So not only you have the data, whether it's fatigue, whether it's cognition, whether it's symptoms or pain, but also we have the data to try to follow those symptoms over time and better understand, how are your fatigue levels changing over time? Are these interventions that Adrian is going to talk in a minute in the Brain Health Clinic, with exercise recommendations, with diet and nutritional assessment, are they changing or making an impact in your symptoms on a day-to-day basis? So this is very exciting. As you can imagine, it's a lot of work to kind of get all of this going. And I say that I'm very proud of our team to be able to do this in a record time. And not only that, but also get funding, which it's incredible. So I hope you're as excited as we are. I also hope that you're part of this at some level, whether it's in the research or in the clinic. And Kathy, I don't know if there are any questions, but we invite you to ask questions, to write them in the chat box. We just changed this system, so I don't know if the participants can ask questions lively, but otherwise they should be able to write in the chat. Is that correct?
That is correct, yes. And there was just a question that came through asking for Jules' contact information. I just replied to that with her email address. But yes, please go ahead and use either the Q&A or the chat. You should have that accessible to you at the top of your screen, and I'll monitor those throughout this session this evening and make sure we address those. Fantastic. Well, Dr. Miravalle, I don't know if we have Dr. Sierra Morales here with us. Has he joined us as well? Do you see him in as Dr. Mirabales said, this is a new platform that we're using for the first time, so please excuse the fact that we're trying to, yes, so Dr. Sierra Morales is here. So Dr. Sierra Morales, if maybe you could do something similar to what I asked Dr. Kaplan, and maybe if you could just quickly introduce yourself, share a little bit about your training and research interests, and any other areas of focus so the audience can learn a little bit more about you. Oh, and we need to open his mic. So Dr. Mirabale, do you see him? This is a crazy system. Oh, so Jules, maybe in the interim, if you could chime in, there was a question regarding whether there is an age limit to the research projects.
So for the patient-reported outcomes project, so that's as a part of standard of care. And additionally, if you do consent to us using your information or your the data, there is no age limit to that one. And then the CLIP MS project, I don't believe there is an age limit, but I'll need to double check on that.
No, the only age limit is 18 or older.
Right.
And so, Kathy, I don't see Fabian. So why don't we maybe jump to?
I see him there, but I can't. I don't think I can undo his mic.
I thought I'd done that.
Oh, did you do it? Oh, allow mic.
Think so.
There we go. Okay. Dr. Sierra Morales? I think you would need to unmute yourself at this point because you should have capability to speak. Well. Okay, well, we might give him a minute or two. I think he's going to try to log out and join us again. So, Dr. Mirabale, maybe in the interim, if we could introduce our newest team member, Dr. Allison Osen. So I'm going to let you take that honor. We're super excited to have her as part of the MS team at Rush. So I'll let you quickly introduce her, and I have a few questions then that I would like to ask, if I may.
Thank you, Kathy. So yeah, we are pleased to announce that we have a new member of the team as of November. So it's very recent, but it's not new to some of you because Ali Olsen, or Dr. Olsen, she's been a fellow at Rush. So she partially trained at Rush, and now she's coming back. So Ali, welcome to the team. And I'm going to have you and Kathy take the next portion of the meeting.
Excellent.
Yeah. Thank you.
Yeah, Dr. Osen. So I have put together a few questions for you. And ultimately, I want to just make sure that everybody in the audience gets to know you a little bit better. So ultimately, these are pretty simplistic questions, but I thought to start out by asking you two questions about your training and expertise, and ask you what inspired you to specialize in neurology and specifically in multiple sclerosis.
Yeah, great question. So, neurology, I think most people find it inherently interesting, of course. I mean, it's the organ that really gives us who we are, our personality. So I think, to be able to protect that for patients is pretty incredible. And then while I was at Rush for residency as well, I had a hard time picking at first until I got to the MS clinic, to be honest. MS also is very variable in how it presents, which is interesting, but it's really the patients that kind of caught my eye. You tend to meet patients pretty young and follow them for decades, which is very cool. just to get to know them and their families. And people do really well. We have so many options for medications that it isn't so much of like me as a doctor saying you've got to do this, but kind of collaborating with the patient I thought was really, really cool. And so I'm happy I picked MS and very happy to be back at Rush as well.
Fantastic, Dr. Osen. Can you tell us about your clinical and research training in the field of MS?
Yeah, so we've done a little bit of research regarding some of the more aggressive drugs that we might not use quite as much. More lately, though, kind of in the Rush tradition, have been more interested in the clinical aspects, quality of life in MS patients. And fellowship did a project I'd like to build on as far as social isolation and how it impacts MS symptoms, particularly the ones we have trouble treating, so like fatigue and pain and brain fog. And we got some pretty cool results, so we'd like to build upon that. And I think that'd be a good fit for the brain health as well.
Excellent. So what are the most exciting recent treatment or advancements in MS research that you could maybe tell us about?
Yeah, a lot of you probably have heard we're hopeful that a new class of medications, the BTKs, are coming out. So hopefully that might address some of the progressive type of pathology and symptoms in MS, which can be incredibly frustrating, for both us, but of course the patients. And so we're hopeful those medications will come out and really make an impact on slowing the progressive types of MS. But fingers crossed. So hopefully those look good.
Yeah. We're all in that boat of hope for better treatments and better advancements. So my next question for you, how has the understanding of MS evolved over the past decade?
Yeah, I haven't been doing it as long as everybody on the call. So as far as my understanding, we've just been, we're more aggressive because we know treating the disease early in the course and treating it aggressively really makes the biggest impact in patients' lives. And most medicine, you kind of start low and go slow, but we know that that's only doing harm most of the time. And so I think that's been the biggest change, at least in my short time being in the MS world.
Yeah. So are you aware of any new treatments or therapies on the horizon for MS patients that you might be able to share with the group?
Just, as I mentioned, kind of those Bruton tyrosine kinase inhibitors are, as far as what I know, the next thing coming up. But there's some other exciting things in the pipeline, but they're pretty far back as far as I know, like CAR T therapy. So if any other doctors or nurses or anybody wants to add to that, that's all I think that's the next up and coming medication.
Yeah, excellent. So maybe moving on to patient care. What are some of the biggest challenges patients with MS face today that you have experienced or seen?
Yeah, I think MS can be quite a big question mark in patients' lives. It's pretty variable in how, the symptoms that manifest and as also the severity. And so I think it can be really hard to plan life sometimes around that. With the newer medications, people do really well, but sometimes it's hard to plan long term, job wise. And I think that's the scariest and most anxiety inducing things that I've seen with patients, just talking with them. So that's kind of the most difficult.
Mhm. Yeah, absolutely. How do you approach personalized treatment plans for patients with MS?
Yeah, that's a good question. I like to start with just asking them, what's your understanding of MS? What's your understanding of the drugs? And just making sure we're on the same page. I kind of see myself as someone that presents the medications and data to the patients, but at the end of the day, we're going to make this decision together. And so I always like to check in with patients and see how they're feeling about all the information, because it can be overwhelming at times. So kind of usually just checking in at each step.
Yeah, and it is important, right? Throughout the whole entire phase of living with MS, to always stay on top of where things are on a personal level for individuals. Can you talk about the role of early diagnosis in improving outcomes for MS patients?
Yeah, sure. I think most of us kind of see this in a similar light, but we know that if we can prevent as many lesions and relapses, you're less likely to have that progressive type pathology, which we don't unfortunately have the best drugs to prevent the progressive part. And so that's why diagnosing early and starting these medications really sets patients up for the most success in the long run.
Yeah, fantastic. And this is going to be an area where I personally am very interested. So how important are lifestyles integration, like lifestyle changes in managing MS?
Yeah, they're incredibly important and they don't get their full respect all the time. We tend to focus on the drugs, right? And I think we know in almost every, neurology type, in dementia and epilepsy, this is a big part that, if we keep our brain healthy, the better off all of us are going to be. But of course, if we have MS and those lesions that affect us even more, it's even more important to really have a healthy lifestyle as best we can. Again, to kind of set us up so nothing will change over time is our goal.
Yeah, absolutely. And I find it to be a really important part of the treatment process to really look at the big picture and other areas of lifestyle management. What role does mental health play in the care of patients with MS, and how do you address it?
Mental health is very important. I mean, having a neurologic disorder puts you at risk for having mental health challenges. And also, if we don't address mental health, how are we going to, improve your quality of life? And it's incredibly hard to do the things you need to do to have a healthy lifestyle if your mental health is not being addressed. So that's something I check in every time we meet. That's really high on the list of something we need to address. And if there's any issues, we have a lot of options. It's not all medications and therapy. It's other things that we can try to address lifestyle wise.
Dr. Osen, I hope I didn't put you on the spot too much by almost creating like an interview here for you. So
no, God, no question. I appreciate it. Yeah.
No, I think it's important for folks to really understand who you are, and these are some critical areas that I think folks would be interested in knowing where you stand on things. So thank you for allowing me to ask you those questions, Dr. Miravalle. Is there anything that I might have missed that you think that folks would like to know a little bit more about Dr. Osen?
Oh, that was great, and really highlights how excited we are with Dr. Osen joining us, because it's a perfect fit. I think her career choices and her interest in different areas of MS is going to be a wonderful complement to what we do in research, what we do in the brain health program. Also, Ali has a specific interest in different type of populations from an ethnic and racial standpoint, and how MS affects different populations as well. So, and speaking of that, I see that Dr. Sierra Morales joined us finally. So Fabian, can you join the conversation here?
Yes, can you hear me?
Yes, we can hear you. Welcome.
So thanks for inviting us, and thanks to all the patients that are here tonight. We've been working with a group of patients already in research, and I appreciate the time that the patients are giving to this research project. Basically, what we're trying to figure out is how the social barriers can affect MS outcomes. And we're trying to do that with a method that is community-based participatory research, which includes the community from the beginning of the project. So patients from the beginning of the project were giving ideas, what questions we should ask, what way we should do the focus groups. And that's the interesting part of this research, that the patients are involved from the beginning. It's two phases. We're doing focus groups to determine what other factors can affect MS outcomes besides the medications, besides the clinical appointments. And we're doing it through focus groups. We're have done around 5 focus groups, and I'm not involved in the focus groups because we want to hear what the patients think and what they need. So that's why a social worker and a patient is leading these focus groups. And we're getting a lot of data from that. It's called qualitative data because we cannot count this data, but we can analyze this data to figure out what intervention we can do to have a better outcome for the patients with multiple sclerosis. So that's the phase 1. And the second phase is we're going to collect data prospectively. We're trying to include around 100 patients, and we're going to follow these patients, and the patients are going to fill the questionnaire about the social factors that are affecting their MS. So it's a very interesting project because we want to get a lot of patients involved. If you are between 18 and 55 years old, you can be part of this project. If you have MS and you started medications for MS within 1 year, you can be part of this project. And of course, if you have questions about the project, we have a research assistant that is helping us with that. We have a fellow that also can help with the questions, but we really appreciate the time and the willing to help us with this research project. And if you have any questions right now, I can try to answer them.
So
Excellent.
Dr. Sierra Morales, sorry, Dr. Miravale, can you repeat the name of this study so folks know if they inquire within the MS Center as to what the study is called?
So the social determinants of health and how they affect MS outcomes.
Perfect. Thank you. Dr. Miravale, I'm sorry.
That's a very important area. When you look at the pillars of brain health, one is access. So not only access to early diagnosis, but access to healthcare. So we understand at Rush that you can have these wonderful programs and resources, but if patients can't access that, whether it is due to financial limitations or geographical limitations, sometimes getting to Rush, it's cumbersome and expensive. So I think being able to understand what are those barriers and how those barriers can affect the access to proper care is critical, is very important. And that's why, when you start looking at how we are creating this program, having that component is perhaps one of the most important aspects of what we do. So for anyone here that wants to participate, anyone that actually feels that you may have barriers to access of care and you want us to know that this is a perfect opportunity, not only for us to get to know more about those barriers, but also for collectively for all of us to be able to mitigate that and be able to provide access to patients regardless of these limitations. Speaking of access, one of the programs that we're excited to work in 2025 will be to decentralize the clinic and open different locations in the Chicagoland area. So I'm not ready for prime time announcement yet, but we are hoping to look at areas, for example, in Oak Park or in the western suburbs, as well as areas in the north side of Chicago. So those are examples of how we are looking at the strategic plan for the next 5 years. In not only programs that we can develop at Rush in the West Loop, but also in other locations as well. So Fabian, anything else that you would like to share with this wonderful audience?
Someone asked in the chat if there is any possibility for remote participation. In our study, yes, for the phase 1, if you want to be part of the focus group to discuss what factors affect your MS, you can participate from home. So the way you do it is you contact Liz, is our research assistant, and we can help with that. I don't know if we can write down the
we
email.
Can share the email.
Okay, so I will write it down in a second. And that's the way we can include the patients from home. Someone else, I think, asked about the age limit. We did it like that because we have data from a retrospective study. Most of the studies are done between these ages, 18 to 55, because it's the age when MS is more active. So that's why we did it like that. But I agree, we need to do something for patients that are older than 55, because most of the patients around the world are 55 or older right now. So we need to change that. Unfortunately, we cannot change it for this study because we already submitted all the IRBs, but yes, that's a fair question, and we're gonna do another project with 55 and older.
Excellent.
Very good. Excellent.
If there's any other question in the chat.
Well, I saw one question about BTK inhibitors, and unfortunately, Dr. Shoemaker cannot join us today, but he is a principal investigator for one clinical trial that is active for enrollment, that is looking at the efficacy and safety of one of those BTK inhibitors. This one is remibrutinib compared to teriflunomide. So that's one study for relapsing patients, patients with MS with relapsing remitting multiple sclerosis. And there are certain criteria that patients have to meet. For that particular study, there has to be some degree of activity, meaning or a relapse or an MRI lesion in the last 12 months. So the study is looking for patients that actually had some activity in the prior 12 months. But this is a Bruton tyrosine kinase inhibitors, also known as BTKI. That's a new class of therapies for multiple sclerosis. We don't have anything approved in that class yet. So it's exciting to start seeing that these clinical trials are slowly starting to release some data. We covered some of that data in past conversations on brain health. We talked about the unfortunate news of evobrutinib, which is the first one that actually released some data that unfortunately did not meet the primary outcome, which was being able to suppress acute inflammation compared to teriflunomide or Aubagio. However, in the last few months, another BTK inhibitor, tolebrutinib, showed some positive results in patients with progressive MS. So those are patients without relapses, without activity, patients that actually has either secondary progressive MS or primary progressive MS. And those results are now being assessed and evaluated by the FDA. We are hoping that in the next 6 months or so, we'll hear some good news. So it is a very exciting class of drugs, as Dr. Olsen mentioned before. And why is that? Because the way they work is they target different types of components of the immune system in MS, not only the acute inflammation, but also elements or cells that are involved in chronic or smoldering inflammation. So it's very exciting. Mechanistically, is a type of approach that actually will make sense, that will hopefully fill an unmet need in MS. Another study that Dr. Shoemaker is working on and is also open for enrollment is a medication of another class, which also we don't have anything approved, which is called anti-CD40 ligand medications. This medication is called frexalimab. It's an IV medication, so it's an infusion given every 4 weeks, and that's compared to placebo. So this medication is going to be studied in patients with progressive MS, secondary progressive multiple sclerosis, without relapses or without MRI activity. So it's, again, going after a type of inflammation that we know that is different to the inflammation that causes lesions or causes relapses, something that we are now calling smoldering or chronic inflammation. So this is a class called a CD40 ligand. So CD40 is a ligand, or is a chemical that is involved in the activation of cells in both the acute inflammatory pathway as well as the chronic. So plays a critical role in different types of inflammation in MS. So being able to block that is actually very attractive from a mechanistic standpoint. So those are 2 clinical trials that we are currently open for enrollment. And I believe that's all from Dr. Shoemaker's update, Kathy. So I'm going to pass it back to you.
Oh, fantastic. Well, I think we have now covered all of our MS doctors in the MS Center there at Rush. So many thanks, Dr. Sierra Morales and Dr. Osen for giving us a little bit of an overview of who you are and what you're working on, and Dr. Miravalle for giving us an update for Dr. Shoemaker. But we have two other key players, obviously, Jules Skoda, who is our research assistant. She spoke briefly as to her work that she's working on together with Dr. Kaplan. But we also have Adrienne Castillo here. And I do want to make sure we give her some space to speak as to her critical work with the Brain Health Center there at the MS Center.
Thank you, Kathy. And I just want to say that I'm really honored to be here and appreciate being able to share in the anticipation of what lies ahead for the Rush MS Center and its patients in the coming year. So as an American College of Lifestyle Medicine trained provider, I'm excited to announce that the ACLM and Blue Zones have partnered recently. Blue Zones is recognized for identifying where people live in the longest, healthiest, happiest lives. So what does that mean for us as a current patient? If you're a current patient of mine or as a future patient of mine in the Brain Health Center, well, now I will deliver quality care to include both lifestyle medicine, evidence-based guidelines, and also 20 years of the Blue Zone's proven research in order to deliver an outcome, not just for health, better life, but a longer, healthier life. So I'm looking forward to partnering with everyone in the new year. My goal for the new year is to see every patient at the Rush MS Center at least one time. I am scheduled in January to deliver a presentation during this webinar time, and the topic is an introduction to Blue Zones. In the meantime, I thought that I'd share a little Blue Zone information for you to keep in mind, especially since the holiday is coming and we want to approach the holiday as healthy as possible. So I'm going to talk about four always, and 4 to avoid. So 4 always means 4 foods to always include on a daily basis. Number 1, 100% whole grains, brown rice, quinoa, oatmeal. Number 2, a handful of nuts. Make it a variety, make them unsalted and not sugar-coated. Number 3, everyone's favorite, beans, half a cup to 1 cup daily. And number 4, 5 to 10 servings of fruits and vegetables per day. Now let's talk about the 4 to avoid. Number 1, sugar sweetened beverages, empty calories, don't go for it. Salty snacks, too much salt and preservatives leads to obesity. Number 3, packaged sweets like cookies, cakes, donuts. Processed or added sugar leads to obesity. And number 4, processed meats such as sausage, bacon, linked to cancer and heart disease. So people in Blue Zones eat sugar intentionally. They don't eat sugar out of habit or by accident. Now, naturally occurring sugar, such as that found in fruit, is not the problem. The problem is added sugar. So, more to come. Stay tuned. Join the webinar in January. I look forward to sharing all that I've learned about the Blue Zones with you. And come see me in the Brain Health Clinic.
Excellent. Excellent, Adrienne. Well, that I appreciate that. And Adrienne is so passionate about this, her work and this area of specialty. So you can read it on her that she loves doing this work with patients. So thank you, Adrienne. And for that conversations on brain health in January, that will be, as most of our webinars for this program, is always going to be the second Monday. And so for January, that is going to be January 13th. And we will have Adrienne as our special speaker to talk about the Blue Zone so everybody can live to be over 100 years old. Fantastic. But thank you so much, Adrienne. Dr. Miravalle?
And with that, Kathy, I think it's clear the passion and the talent in the MS group here, Raj. And if you look at all the elements, right? So from Dr. Olsen's interest in highly effective therapies and how those therapies actually make a difference, particularly when used earlier in the course of the disease. Looking at Dr. Kaplan's research interest in understanding how this intentional intervention of lifestyle changes could make a meaningful change in people's not only life and symptoms, but also in the biology of MS. So his research is looking at, biomarkers, clinical outcomes, MRI outcomes. It's truly getting to the question of, can we get the evidence that we all want that it can prove that when someone follows a healthier lifestyle, whether it's through exercise, through nutritional strategies, sleep, management of comorbidities, mental health, social isolation, all the pillars that we know that are important in brain health, can you truly show that we are making an impact in the biology of the disease? So that's a very important aspect as well. When you look at Dr. Sierra Morales' research in understanding what are those barriers of access, critical point, as I mentioned before, if someone can't have access to healthcare, then no matter how wonderful your programs are, you're not going to help those individuals. So understanding those barriers is the first step to being able to break those barriers. When you look at what Dr. Shoemaker is doing in trying to bring the latest of therapies into our clinical trials program and being able to offer those therapies even before they are approved to our patients. And we follow a very careful process in terms of understanding which clinical trials we're going to participate. We don't participate in all the clinical trials. We pay attention to understanding, from a safety standpoint, from a relevance standpoint, is that a trial that actually we want to be part and we want our patients to participate. And then when you look at what Jules and Kathy and Adrienne are doing with the educational portion of the brain health program, with the clinical component of the brain health program, you truly start to see all the pieces together, that we can say that we can offer patients, hopefully, the tools that you need to understand, to act, and to access care. So those are the main areas. But we wouldn't be able to do that without you. So we truly value this partnership. We truly value the trust that you put in us as your healthcare team. And as I mentioned before, we welcome your opinions, your feedback, any ideas for 2025. We want to continue to do the best we can to serve you and to be part of your journey. So with that, I would like to pass it back to Kathy so you can conclude the meeting.
Thank you, Dr. Miravalle. And I do want to just maybe put in a couple of words on our educational brain health program. So as everyone knows, we run these monthly conversations on brain health, but there is also the it went from 3 weeks then to 2 weeks, but I'm going to be shifting it back to 3-week MS brain health program, which takes a multidisciplinary approach. So several of you on this call, I recognize names who have already participated in that program, but for any of you who have not, we have a fantastic group of instructors that are all within the Rush network. And they each take a specific role and do a session, whether it's our physical therapist, Dr. Ann Zerfas, to our music therapist, to our nutritionist, Dr. Holland. So we really have a fantastic group of instructors that are a part of that program. So I will continue running that in 2025, and that I'll have that calendar released here very soon for any of you folks that have already registered for that. But I will be starting up the next one probably very early in the year. So be on the lookout for anyone who's interested during the winter to participate in the program. It is virtual, so you can do it from the comfort of your home. And that is a program that runs from 6 to 7 p.m. Central Time. So always welcome to have extra folks join us for that. But I'm really thrilled that we were able to have the entire MS team on this last session of our conversations on brain health. So everybody gets to meet who our fantastic crew is, and get to know everybody a little bit better. And we're super excited about the work that's going to come for 2025, and hope everybody has a lovely end of the year. And we look forward to seeing you in 2025. So as I had mentioned, the next conversations on brain health will be January 13th. So I'll be sure to notify everyone when we have that all set up. So I think that's it for this evening. We're ending a few minutes early unless anybody has any remaining questions or any last comments from the team. I think we're
Kathy,
good. Yes.
I just wanted to point out it's the end of the year. There might be, this is a completely different topic. If you have any insurance changes, it is so important to let us know about those insurance changes so that there's no interruption in receiving your medication, whether it comes from a specialty pharmacy or through the infusion center. So absolutely report any changes of insurance to us right away.
Oh, that's super important. Thank you, Adrienne, for bringing that up. Yeah. Excellent. Well, if anyone on this call or this webinar has any questions particular to what we discussed tonight, everybody has my email address, obviously, since I'm the one who sent out this webinar. Feel free to reach out to me. And if it doesn't relate to anything I do in particular, I know how to reach out to the rest of the team and pass that information on. So don't feel shy. There is one question that just came through. Do you have a I think that's supposed to be psychologist. So
We do.
yes, we
Yes,
do.
we have
And
a
that's
wonderful team.
Yeah, Dr. Monica Diorio, and she is actually a part of our MS Brain Health program as well. She's one of our instructors. She's fantastic. Dr. Miravalle, did you want to say anything about her?
I just, we have a great team. And just to conclude, happy holidays, everyone. I hope you can enjoy a wonderful time with your loved ones, and we'll see you back in 2025.
Yes, absolutely. Have a great evening, everyone, and we'll see you next year. Thank you.